I'm not the house of cards that falls down easily. I'm strong enough to handle what you throw at me.
Welcome to Mental Health News Radio. I'm your host, Kristin and Dr. Just what are we going to discuss? The intimacy that is mental health. Let's continue to make it as comfortable as discussing brain health or heart health. This show has been on the air for several years and we have amazing co-hosts. And then we created a network of podcasters on mentalhealthnewsradionetwork.com, a place where every possible facet of mental well-being can be talked about openly. My show, after several hundred interviews, the format is this: intimate, deep, funny, touching, sometimes uncomfortable, but always vulnerable conversations with interesting people. The goal is to have you, our listening family, many of you who have become my good friends, feel as though you are listening in on private conversations. Thank you for tuning in and becoming part of this amazing journey with me, and now with our network of podcasters. Just knowing this podcast might be helping any of you realize you are not alone on this journey called being a human being makes doing this podcast worth every second.
After all we promised, we'd be cordial.
Dr. Marc Feldman, I'm so excited to have you back on the show. Thank you so much.
Oh, I'm glad to do it. This is actually my fourth appearance, so I'm an old pro.
I know you are, and the shows always do so well, and that makes me happy because Munchausen is not what many people would consider a popular topic.
No, most people, if they even know what it is, equate it with what the public knows to be Munchausen by proxy,
right?
Which is a form of child abuse, a medical child abuse, in which a child is victimized by overuse of the healthcare environment. So I get emails all the time saying, can you help me with this case of Munchausen? And I never know whether they mean Munchausen by proxy or do they mean the adult form where someone makes him or herself sick to get attention. That's the one I usually think of. But the media have grabbed onto Munchausen by proxy. There's been show after show, some true crime, some fictionalized, and people think that's the only type of Munchausen that exists.
Right. They do. And there's so many ways. I actually had someone write in after the one we did about the abuse of pets.
Yes.
And I had someone write in very angry and say, well, does that mean that my anorexia that I've had for years means I have Munchausen? And they just went into this whole diatribe of what they're upset about. And of course, I was very compassionate, but I said, I can't, answer that for you. I'm not an MD, nor am I a counselor. But that
happens.
came from the pet, those show we did about pets.
Yeah, and just to restate that a bit, pets can be used as surrogates for children in Munchausen by proxy cases. And in my last book, which is called Dying to be Ill, I have a whole chapter called Munchausen by Animal Proxy, which recounts cases in which dogs, cats, horses, even rabbits have been mistreated and then taken to the vet repeatedly with the owner saying, I have no idea what's going on. And they do this over and over and over, and often the pet dies ultimately. And the person who's doing it, the human, seems to be getting some sort of emotional satisfaction out of it. Right. They're not usually after gifts and money and things like that. They're after the vet's attentions. In a couple of cases, the human has fallen in love with the vet and wants to arrange ways always to be in contact with the vet. It's very distressing. But the difference between, say, anorexia or nervosa and Munchausen syndrome is that in anorexia, the person is not intending to mislead others. They may have some secret behaviors, but they're honestly ill. Whereas in Munchausen syndrome, the person knows that they're not sick, or if they are sick, they've self-induced it.
Yeah, absolutely. And it's amazing how much anger this incites in people that and I always wonder what's going on with them to send such an irate and angry email with something that didn't seem like it had anything to do with the other, but
Yeah, that's right.
those are signs of something going on.
Well, I have a website called Munchausen.com, and I get about 450 emails a year through that site. And I would say 99.5% of them are really appreciative and pleasant. It's rare that I get somebody who complains, but when they do, I do respond to every single email. I try to do my best to clarify whatever misunderstandings exist, and I make friends with all of them. I can't think, looking back over the years, and I've had this website since 1996, believe it or not. Going back through the years, I think I've made friends with even the angriest of people. So It's gone well, and I enjoy answering those emails.
Good for you. Good for you. I think we're at like 500 a week. So I must say I'm not.
Oh my goodness.
I'm not as good as you are about.
I think I can understand why.
Everybody. Well, we have a topic today that you are much better at introducing than I. So do you mind doing that for our listeners?
Sure. And my voice is coming and going, so I apologize for that. Not much I can do about it, though. But what I'd like to talk about today is Munchausen by internet, which is similar to Munchausen syndrome. It's when a person feigns or exaggerates an illness for emotional satisfaction of some kind. But in Munchausen by internet, it takes place primarily or exclusively online and social media. So some of these patients may in real life lie about having illness or self-induce their illness, but others go online and out of whole cloth manufacture tales of being terribly sick. They form caring relationships with other people, that is, others care about them. And these can be really consuming friendships that are based ultimately on trickery. And you can imagine for those who have given their time and attention to the poser that it can be devastating when they realize that they've been misled. A lot of these occur on perinatal and maternity support groups, because claiming to have a very ill child or to have a baby who died is guaranteed to elicit really authentic and loving concern from other people. So it doubles the sense of betrayal when it's discovered all to have been made up.
Right. And people tend to go after that person. And that's where there's such a fine line with, you understand why people get so very upset because they've been so profoundly betrayed. And then there does have to be someone like you who works with the person who's doing it. And you have to have a measure of compassion, much compassion for why would they do this kind of behavior. And I always wonder, because I have someone that, the only communication they have with me, and I've just put an end to it, is for me to be irate and they try to incite me to go after who they feel are trolls online.
Yeah.
And my response to that now, I used to be very upset about it. And now I think with everything that's going on in the world today, and even in this week, because it's the first week of June of 2020, I think, so what's the end to that? So you're upset with someone, you're going to try to get them fired from their job because of what they just posted online. And where does that end? That person doesn't just die and go away. They're a person.
Well, that's right. And you may notice that several minutes ago, I used the term poser to refer to them. I used to call them perpetrators. And then I realized that has such a pejorative connotation that it implies this is all deliberately intended to upset others and lie to others. But really, as you're pointing out, what drives it for the posers tends to be serious unmet needs and psychological conflicts that they may not even be aware of themselves. So I've published quite a bit in the medical literature on the subject of Munchausen by internet, and I don't refer to them as perpetrators ever. They're posers, as I view it, though, increasingly we may want to call them patients, because I was involved with the development of the next edition of the Diagnostic and Statistical Manual of Mental Disorders, the DSM. And there we're going to acknowledge for the first time that what's technically called factitious disorder, which is a substitute term for Munchausen syndrome, can in fact take place exclusively online. And that's considered to be, the diagnosis of factitious disorder is considered to be a formal mental illness on the level of depression or bipolar disorder or schizophrenia. It may not be considered a serious and persistent mental disorder, but nonetheless, it's one that the American Psychiatric Association has said really merits much more attention than it's gotten to date.
Yes, absolutely. Absolutely. And I wonder, we've talked on other shows about people who, nurses or doctors, the people treating patients, posers, and being so angry and upset. And where do you place that? And it's even harder when it's online, because it's like road rage. It's so much easier to be angry in your car because you're not actually looking at another human being. Yeah. And the internet gives that space also. So how do you deal with trying to explain this to people who just they don't even have a human contact to put any kind of compassion towards it?
Well, I mentioned my website before, and I have a whole page devoted to Munchausen by internet. And I also have lots of personal narratives, including from posers who talk about why they did what they did. And I think if those who feel they've been victimized will take a look at those, some of that anger will attenuate and hopefully transform itself into understanding. These are not evil people, but there may be exactly the kind of rage you're talking about. And that may be part of the reason with Munchausen by internet that these posers disappear promptly. They may go on to another support group or special interest group and continue the same behavior there. But more often, the moment someone detects that they've been lying, they simply disappear.
Right.
Now, there is a Reddit group I found out about not too long ago that is drawn heavily from my work, but they never consulted with me. But they devote themselves toward something called doxing, DOXXING, I think it is. And I hadn't heard, I had to look it up, but it means that they not just expose the lies, but they give the real name and sometimes home address and office address of the poser, and produce documents, medical documents or other documents, giving factual information about them and their personal lives. And that's really troublesome to me. And I don't know anyone outside that Reddit group who would really endorse that kind of wholesale exposure and punishment of people who are, yes, acting out, but they're acting out deep psychological conflicts.
Yeah, that when you take, it's so interesting that this is what we're talking about today, because just recently I've been asked to just really go after people because of things that they post online, to the point of sending things to their employers, digging in to find out where they work and where they live, and sending things to their homeowners association to call them out for their behavior online. And I just sit back and go, why? You're becoming the abuser at that point in my mind. And that is not the way to handle situations, especially if you're supposedly someone in the field of mental health.
That's right. And the only conceivable exception to that would be when the person isn't, the poser isn't so much after emotional satisfaction like attention and sympathy and concern as after money and gifts.
Right.
That does happen in some cases, and we call that malingering or malingering by internet. And that is a crime. That's actually criminal behavior.
Right.
The police would rarely prosecute it, but sometimes they do. It's not zero. It often depends on how much money has been obtained illicitly. Often the number I've heard is $5,000. If the poser has been able to get $5,000 or more in gifts by claiming to have serious medical problems for which they need money for chemotherapy, et cetera, that then I do lose my sympathy and think that that does need to be pursued, though I still wouldn't take my battle with them and act it out online.
Right, exactly. There has to be there are other ways that you can spend your energy to combat things like this that actually make a lasting difference than the tit for tat that goes on online.
Many of the supportive individuals do have issues of their own, especially codependency issues.
Right.
And I've asked some of them, why did you spend 12 hours a day online with the poser? You can't just blame the poser for that. Something is going on inside you that compelled you to behave in that way and to put your life on hold for the apparent benefit of another person. What's that about? And there have even been books. One is called Have You Found Her?, which is about a case of Munchausen syndrome where the author of the book, and it's a true story, devoted so much time toward caring for this patient with Munchausen syndrome that I came away less interested in the person with Munchausen syndrome than in this codependent individual, the writer.
Right.
I think I provided you with a exemplative case of Munchausen by internet from my own experience. Would you mind reading that?
Of course. This is from this is obviously from something that was sent into Dr. Feldman, so I'm reading this as her. My name is Robin, and I am currently 53 years old. I was 9.5 when my little sister was born. That day changed my life forever, not just because I was no longer the baby, but because my sister was born 2 months early and was diagnosed with cerebral palsy. She needed a lot of care and attention, and that's when I became the invisible girl. A couple years after her birth, I began faking things to get the attention I was missing out on. It was something that went deeper than just getting attention. It was seeing how my sister received love, care, affection, attention, and nurturing, and wanting to be like her. It started with faking an eye exam in elementary school so I could get glasses like my sister, and grew to seizures in high school, and cancer in college, to a stroke in my late 40s, and many other things throughout the years. It wasn't until the late 1990s when I began faking illness online, now known as MBI, or Munchausen by internet. It was around 2006 when I reached out for help from professionals. I saw several therapists and psychiatrists, but it wasn't until 2011 when I started with my last therapist that I worked on recovery. I spent about 6 years with this therapist, and now I no longer participate in Munchausen behavior in any way and have not for many years. My message is that recovery is possible.
Yeah, I'll stop you there, though it goes on to talk about recovery. But I think when you listen to that, it's hard to feel as angry toward these patients because they often have similar stories of, she talks about being the invisible girl. They felt emotionally neglected, sometimes were physically, emotionally abused. The abuse could take many forms. At least that's what they're reporting occurred to them. And they developed these pathological ways of getting their needs for attention and concern met. And when you hear the story underneath the Munchausen by internet case, you can't help, I think, but start to understand what's really going on, and that this isn't nearly as malicious as you would believe it is, at least not in most cases.
But we're so quick to just be righteously indignant about things that we read online, me included. I have to stop myself and go, wait a minute. Okay. These are words. It's so different when you meet the person or you read the story behind it. There's always more to the story. Sometimes more to the story is actually horrific and this person belongs in prison. If they've done, if they've killed someone or molested a child, of course, I'm not saying, listeners,
Right.
that there should be free passes to anything, but that knee-jerk reaction to just go to DEFCON 1 over something that you just read or saw online or heard about, and without taking a pause, taking a breath, taking a beat, and knowing, and that there are always other things going on. To me, it's just irresponsible to be so inflammatory so quickly about everything that has to do with being online.
I found that, unfortunately, healthcare professionals, and this includes mental health professionals, take a punitive stance themselves because they don't know very much about Munchausen syndrome. They may know a little bit about Munchausen by proxy when it's the child who's victimized, but they know nothing about Munchausen by internet. And their behaviors can be really counterproductive. It's hard to get these posers into therapy of any kind. And when they finally agree to it, we have situations where the behavior of the professional ensures that they won't get better. For example, they'll say to the patient, who is now formally a patient, if you do this again, this is part of our treatment contract, then I have to terminate therapy with you.
Right.
And we've talked about this in other shows. That's the opposite of what they should be doing. They should be willing to weather storms with patients. But what they do is say, and this is true for real life Munchausen syndrome too, you're not allowed to express the symptom that brought you here. Could you imagine saying to a patient with schizophrenia, if you have another delusion, I'm not going to treat you anymore?
Right.
I mean, it's absurd. It makes no sense. And yet that's what happens in these cases. So I find as a consultant that I spend a lot of time educating the therapist more than the patient about how to approach the patient and how to offer the kind of acceptance and understanding that may have been totally lacking during their childhoods.
Absolutely. I've seen that happen with borderline personality disorder, just being so quick. Therapists especially, I just won't treat anybody that has that has this, and I understand where they're coming from because some of them have had horrible experiences, and I also see, okay, how far does stigma go?
Yeah. I think one of the most important things that a therapist can do is be aware of his or her countertransference, which is his or her reactions to not only what the patient says, but how the patient behaves, and be aware of emotions that you have to take responsibility for as a therapist that may stem from your past and your conflicts, and not just project them onto the patient. It's a challenge, and you may need a lot of supervision from senior colleagues to avoid negative feelings undermining the therapy. And again, this isn't just for Munchausen by internet, but it's for Munchausen syndrome, and in those cases in which we try to undertake treatment for Munchausen by proxy perpetrators. And there I do use the term perpetrator because it's a crime, obviously, to engage in child maltreatment. I also provided you with a case of a boy named Chris. At least that's the name that was used online. Would you mind reading that?
Absolutely. A person describing himself as a 15-year-old boy began to post to an online group for people with migraine headaches. His reports about his struggle with intractable migraines were moving, particularly in view of his youth and the unique personal qualities he described. Over time, Chris disclosed that he also suffered with hemophilia as well as a seizure disorder due to abusive head trauma his estranged father had inflicted. Despite these ailments and his brother's recent death from AIDS, he was performing superbly as a fourth-year medical student. His mother was described as deaf and his stepfather as alcoholic. Their lack of interest in his education resulted in his having to skateboard 3 miles daily to a bus stop to get to his medical school classes. His nighttime employment as a drummer at a nightclub was a useful distraction, however, and helped pay for his pain medication. Although this information was provided only gradually, some group members could not escape the impression of escalating implausibility. It strained credulity that Chris played the drums even in the throes of a migraine. One group member privately emailed others, and Chris was gently questioned about some of the dubious information. In response, Chris's mother, in quotes, signed on and chastised the group for doubting him and subverting his faith in its caring nature. She warned that the questioning might precipitate a recurrence of the profound depression Chris had suffered in the past. As some continued to ask him questions, for example, the name of his medical school or even the state it was in, Chris complained that they had violated the spirit of the internet and stopped posting to the group.
Right. That's one of the earliest Munchausen by internet articles I produced. It was actually the one in which I coined the term Munchausen by internet, and it was an early case. Now, reading it, and I had to keep it brief because it was published in a medical journal and there wasn't that much space, it sounds ludicrous that anyone could buy into this. A 15-year-old fourth-year medical student, just that alone, unless he's Doogie Howser,
Right.
It doesn't happen. And all the other crises, unbelievable when it's all put together. But the woman who alerted me to this case and described it to me said it was a matter of many months, if not years, in which he gradually provided the information. And nobody wants to doubt someone who makes claims that they have profound neediness, or profound needs, I should say. The claims also were so audacious, so outlandish, that you can't believe anyone would have the audacity to make it up. Now imagine that he had reported having cancer. What would it be like to say to somebody who might have cancer, does have cancer, I think you're making it up? I mean, it's the most inhumane thing you could ever do. And so nobody questioned Chris until it just became inescapable that this couldn't be true. And as in so many cases, as we talked about, he ultimately just vanished. He may still be online doing the same sort of thing elsewhere, but I've not been informed of that.
And there are so many people that do this online, that craft entire worlds for themselves online, and they're so out of touch with human connection. That if you dare to question that world at all, the rage that is inflicted upon you, and then inflicted upon you online if they have a following.
Yes. And it's been a challenge even trying to study this phenomenon, because those who have been misled are often embarrassed and uncomfortable and don't like to talk about it in many cases, whereas the posers may fear repercussions, sometimes legal, but sometimes just that they'll be doxxed, to use that word I used before, and that they will be exposed and hunted down for what they've done in the past. So they don't want to talk. So it's been a process of accumulating anecdotes over the years. And I've now published probably 5 or 6 articles on the subject that I could only write because of the generosity of some posers and those who were misled, in sharing the stories with me.
Yeah, and I wonder, how serious, or what are the discussions around Munchausen by internet in the medical community?
There are several others who have written on this subject, and for a while I felt hounded by the media when my first article came out in the year 2000 on the subject. It got picked up somehow, and I still don't know how, by the Associated Press. And I didn't realize they read this obscure medical journal, but apparently they did. And I got dozens of inquiries, not just from posers and those who had been misled, but from reporters, TV stations. It goes on because it's so dramatic in a sense, and everyone can kind of relate. It involves social media, so it's a contemporary topic. And I also pointed out in that first article that maybe Munchausen by internet is more common than real life Munchausen syndrome.
Agreed.
Because it's so easy to do online.
Absolutely.
And if you're discovered, you can just go to another group and do it all over. Whereas it used to be in Munchausen syndrome cases, the people had to go to medical libraries, read up about esoteric ailments, then go to the emergency room, act it out in a convincing way, continue it in the hospital. Well, none of that is necessary anymore. I can be on a social media group, within seconds. And if I don't find one that is supportive enough, switch to another. So I do think it's become more common, not less common over time.
How do you even begin to start treating someone? I mean, first of all, they have to have the wherewithal to know that it's become a problem and seek treatment.
Yeah, that's right. And again, in the book I published 2 years ago, I had some very kind therapists come forward and provide me with lists of how they framed their therapies with Munchausen by internet patients so that it maximized the chance of success. So for someone who, especially a therapist, who wants those guidelines, they can just turn to the book, but I'll mention a few of them. One is to emphasize that treatment is going to be a long-term process. There's no quick fix and it can't be hurried. And so if the patient wants to get better and the therapist wants to be helpful, they need to recognize that therapy may require a considerable period of time. Another is for the patient to recognize the path they're on, the destructive path they're on, before they've done something irreversible to their bodies. And that's in the cases in which they've actually induced illness as well as exaggerated or feigned it. Because then you get into the quagmire of what's a real illness that needs medical attention and what is primarily a psychological manifestation of Munchausen by internet. We talked about this one before, but working with colleagues, you may need to involve both medical and mental health professionals to supervise your work, provide input, and keep you from acting out any of the countertransferential feelings that threaten to undermine the therapy. It's important also to be non-judgmental. Patients don't ask for Munchausen by internet. There's no place to go and say, gee, I'd like to have this. They have the underlying needs we talked about before. And the more judgmental we are toward them, the less likely they are to find those reasons with our help. And I think lastly, we have to stay hopeful. It may seem that these patients will never learn the skills they need to manage their urges and their behaviors, but I've seen wonderful outcomes in enough cases that it's made me hopeful. And since I'm considered to be an expert in this area, I hope I can communicate that hopefulness to other therapists even those who have very little experience in the field.
For anyone that's listening, to you for the first time, and I encourage you listeners to go back and find the other shows that I've done with Dr. Feldman. But for anyone listening for the first time, can you talk about your role, what it is, the work that you do today in terms of seeing patients or not seeing patients, doing research, being a consultant? What is your work consist of today?
At this point in my life, and I won't say how old I am, I have focused less on treating patients clinically than on doing consultations and doing medical legal work. These cases, whether it's Munchausen by internet or especially Munchausen by proxy, but sometimes in other variants, often bounce up against the legal system. For example, it's just an undeniable fact that some people who file workers' comp or personal injury cases have feigned or are exaggerating the illness they're claiming deserves compensation. And sometimes I work on behalf of that patient if I think that they're being falsely accused of making things up. In other cases, I work for an employer or insurance company and assess as honestly and thoroughly as I can what's going on, and then testify around the country in these kinds of cases. So the bulk of my work is limited at this point to legal consultation and occasional diagnostic assessments face-to-face in those cases in which I'm trying to ascertain the truth in a legal case. And then I've always written. I've written hundreds of articles over the years, and I'll never stop. In fact, I've got a few going on right now. So I try to keep my articles going, and they're published mostly in the medical literature. But as I said, they're often picked up by the media. So and I like that to an extent if it's responsibly reported, because it gets the word out more than I ever could with the limited medical journals I tend to work with.
Well, the thing that I really appreciate about you is you never forget about the compassion for the patient. It doesn't matter whether you're doing this for an insurance company or you're working directly with a patient or a poser, as you've said. There is no lack of compassion for what's going on with the person who's exhibiting the behavior.
In the book, and I'm sorry to mention it so often, but it's fairly recent, I have a chapter on false accusations. It's called Jumping to Conclusions, False Accusations. And it kind of shifts to a focus on patients and the fact that they can be falsely accused of manufacturing an illness, whether online or in real life. And this can happen in Munchausen by proxy cases. So I testify sometimes on behalf of accused mothers whom I believe have been falsely accused, and that people have indeed jumped to conclusions. And I think it's important to do both, to work to expose in court settings deceptions that might be influencing others and have real ramifications in terms of payments, et cetera. But it's important also to testify for those who, and to advocate for those who have been falsely accused, to show balance in your work. One thing I found is that almost nobody does what I do in the sense of testifying where the facts lead. When I ask experts around the country to accept cases in which I think a mother has been falsely accused of Munchausen by proxy, I almost never get a favorable response. And I think that's unfair and potentially destructive to their own reputations. I mean, I feel empowered by the fact that I'll work on both sides of the case, depending on where the facts are. And I think to always assume that a legal or other complaint is valid is potentially to do a real disservice to some patients.
Absolutely. I ask the people, anyone that's listening, and this comes from me being just as quick to judge. This is not me acting like I've never been this way, but as things are heightened out there, especially right now, people are just looking for a place where they can vent their anger at something they've read or they've seen, and we don't always know that that's the truth. I ask you to really take stock in your own anger and rage before you decide to make the leap from just being outraged to then going and attacking someone that you feel is attacking. Question, what has that made you turn into?
Well, people ask me a lot why I study these patients and posers, and I've done it for 30 years and never lost interest. If anything, my interest has increased over time as I've learned more. I've never felt angry at these patients the way so many therapists are, at least initially, before they've really gotten to know the patient. I have, since the first case I had in 1989, I felt like I wanted to understand what was going on and be helpful. It's just that simple. It sounds like I'm being laudatory towards myself, but I don't even know the reasons I feel that way. Right. People say, aren't you exasperated? So many of these patients are unwilling to even enter into therapy. They've misled others. They may have procured gifts and money. And for whatever reason having to do with my background, I just don't feel that way. So I don't think this is work that everyone is cut out for.
Right, absolutely.
They have to recognize their own limitations as therapists, if we're talking about therapy, and perhaps not treat certain patient groups if they don't have the personal interest and resources for it. Otherwise, you get the kinds of expressions of anger that you were just talking about. And that can bring therapy or just any interpersonal relationship to a screeching halt in ways that nobody would really want.
Absolutely. Dr. Marc Feldman, please tell our listeners where they can find out more about you.
Well, they can find out a lot more through my website, which is Munchausen.com. That's MUNCHAUSEN.com. There are many pages to the website, depending upon people's interests. They can find my biography. They can read about the new book. They can read personal narratives from patients and therapists. They can read about Munchausen by internet. So I've worked on it for such a long time that I'm happy with the way it is these days. Hopefully it's easy to navigate, and that should be the starting point. In addition, the book I mentioned before is Dying to Be Ill, and that's available at Amazon and the other online booksellers.
And you'd be surprised, listeners, at how great this book is.
Thank you.
It's so well written and so compassionate. It made me really question, wow, how I thought I was a compassionate person. I need to work on it more.
You sound compassionate to me. I don't know about that.
Well, thank you for coming on the show again.
Yes, glad to. Anytime.
Absolutely. And listeners, thank you for tuning in to another episode of Mental Health News Radio.
Hi, listeners. I'll make it quick. These are some really cool places that give discounts and other cool things for listeners of Mental Health News Radio Network. If you want to get amazing help with healing from narcissistic abuse, go to healfromanarcissist.com. If you want CBD products that are the best of the best, I use them myself, go to PROZE.com and use the code mentalhealth20, mentalhealth20. If you want to get daily perk ups that help retrain your brain to think more positively, go to perkupdaily.com. And also, just because this one's fun, snarkycandles.com.
snarky.com. I guarantee you'll love them. Snarky with a Y, SNARKY, candles.com. And don't forget, if you want to hear all the shows on the network about first responders, you can go to firstrespondermentalhealthnetwork.com, and all of our shows that focus on narcissistic abuse, narcissisticabusehealingnetwork.com. Thanks for listening, and back to the show.
Sometimes I'm passive aggressive, but never without good intentions. I heat up and act on my emotions.
Thanks so much for listening to Mental Health News Radio. Our podcast can be found on iTunes, Stitcher, and hundreds of other podcast apps, or you can visit our website at mentalhealthnewsradio.com. If you have a question or would like to be a guest, become a podcaster on our network, or join the amazing organizations that help keep us on the air, please email us at info@mhnrnetwork.com. Get ready for that special goodbye from our resident therapy dog, Miles, and a special thanks to Emily Sohn for letting us use her incredible song, Cordial, for our podcast music. Listen to the full song on SoundCloud at emily.sonne.
Don't be surprised when I don't hate on you.